Patriots! However, given the current administration, perhaps I should have said, greetings, comrades. My name is Dr. Steve Spontak. I'm an emergency physician, and I hope today to be talking about why we should not be passing Obama's healthcare reform bill and ways we can resist it and make sure it doesn't pass. Unfortunately, that time has passed. So what I hope to talk about today briefly is three things concerning his healthcare reform. Number one, what happened? Number two, what does it mean? And number three, where do we go from here? So number one, what the heck happened? Basically what happened in one of the most partisan actions in our history, healthcare reform was passed on the evening of a Sunday, May 21st. It was opposed by all Republicans and many Democrats, passed despite popular opposition, passed despite 75% of Americans being satisfied with their health care, will lead to massive increase in government control of health care and, quite frankly, 1/6 of the U.S. economy. It's going to raise taxes and form new taxes, and it's a massive bill. Even today, it's unclear exactly what's all in that huge piece of legislation, and I got no comfort from Nancy Pelosi telling me we have to pass the bill to find out what's in it. So what does all this mean? Representative Paul Ryan from Wisconsin, I think, hit the nail on the head. This legislation is more about government control of health care than it is about increasing quality, increasing access, and decreasing costs. Some of the things we know that this will do, and this isn't everything, is it's going to enforce everyone to get some form of insurance or risk fines or other penalties. It's going to greatly increase regulation of the health insurance industry. It's going to charge huge fees to the health insurance industry. These are basically taxes, which of course will be passed on to consumers. It's going to charge huge taxes and fees on pharmaceutical companies. It's going to increase the Medicare tax rate. It's going to form new Medicare taxes. It's going to fine companies that don't provide some sort of health care for their workers. And one of the most perplexing things, in order to cover more people to get uninsured covered, it's going to increase the rolls on public aid, which is Medicaid. That's basically a state-run program. Illinois' Medicaid program is broke. It can't pay for what we have now, and under this plan, we're going to add millions to our rolls. It's a recipe for disaster. I believe, as do many, that this will eventually pave the way for universal health care, or the public option. It's not in the bill now, but I think this sets the stage for that to happen eventually, and that's really what the progressives want. They want much more control over our lives, and in this instance, over health care. There's some steps that could have been taken that would have addressed many of the problems we have, and these are steps that were all proposed by the Republicans but shot down by the Democrats. Allowing people to purchase insurance across state lines. Right now, as things stand, you can only buy insurance that's sold in your state. If you can buy insurance across state lines, that would dramatically increase competition and decrease costs. Make health insurance, if you have to buy it for yourself, tax deductible. If it's provided by your company, that doesn't apply. But if you have to go out and buy your own health insurance, that should be tax deductible. That's a no-brainer. That would greatly decrease costs. Allow patients to act as consumers, so they have control of their money. So when they go out and they have to purchase a test or get a test, now the market has to compete to get their business. So do one of two things very logically. It will decrease costs and markedly increase the quality of the health care. And last but not least, liability or tort reform. I can tell you this costs our system millions of dollars. Millions of dollars. I always love it when a lawyer tells me that I don't spend any extra money because of the liability crisis. It's quite laughable. Obama actually had the gall to tell the United States physicians that liability reform was not part of his health care reform. And that's a major problem. Basically, Obama's plan has none of these features. So my third point, where the heck do we go from here? First and foremost, I think we need to thank those that stood up to this legislation. There's several Democrats that voted against this. There was only one Democrat from Illinois that voted against this. It's Representative Lipinski. I'm usually not a big supporter of Lipinski, but I called his office to thank him for being courageous and standing up to this legislation. Number two, we may be able to reverse some or all of this, probably not all, but some of this legislation, or at least change it. A lot of this is going to depend on what happens in November at election time. We must keep in mind, though, even if we can put legislation forward, Obama still has, for at least the next 2.5 years, has the veto power. There's lawsuits that are started by states to challenge the constitutionality of this legislation. Unlikely to be successful, but they should be pursued full bore. And my most important point, we need to replace those in government that would like to increase control on society and our lives, which runs contrary to our Constitution. We need to be vocal when progressives in government try to expand government control over our lives and over our society. They already control much of the auto industry and the banking industry. Next, they're going to go after immigration policy. We need to be ready for that. Most of all, we must not become complacent. We need to vote out those who do not respect constitutional restraint of government. And finally, we need to stay educated, stay informed, and stay angry, especially in November at election time. Thank you very much, and God bless America.